So welcome back to the channel. This is Not a Real Doctor DPT, and my name is Eric. I'm a licensed and practicing doctor of physical therapy. And today we're in the third of a 5-part series on the basics of the field of physical therapy. Today's topic we're going to discuss is when should you seek physical therapy care for yourself or for a family member. So as we mentioned in the previous two videos, and there's a storm rolling through right now, as we discussed in the previous two videos, physical therapy itself is the art and science of putting your body into the best position so that it will heal itself. That's primarily how physical therapists practice, utilizing the tools of manual therapy and exercise. And we discussed in our last topic, or our last video, as to why you should seek physical therapy. That's because we're looking at working with anytime a person is having pain or dysfunction in movement. That is what we can actually help with. So when we build off of those and talk about when should you seek that care, I really can't stress enough the most important time frame for when this should start and when it should happen is early on in the process. If you seek out the care of a therapist early on when that knee is starting to bother you, or early on when your hip is starting to bother you, then we can help to prevent the eventual surgery to replace that knee or to replace that hip. We can do that through helping the joint to move better, helping to strengthen the musculature of the hip so that the joint is not having to work quite so hard. But if you wait for those conditions to linger, for inflammation to continue to build in that joint, then you're going to eventually get to the point where you're not going to be able to, that condition is not going to be able to be helped with physical therapy. You're going to have to seek more care from the medical community, which is likely going to involve eventual surgeries for those conditions. Same thing goes for if your loved one is having difficulty standing up out of a chair or difficulty getting out of bed. That's a person who desperately needs home health to come in early. Come to see, get that physical therapy care in front of your loved one soon, because what happens as a person is progressing with that, they're not going to be progressing in a positive direction. They're going to be progressing in a negative direction. They're going to be negatively adapting to the lack of movement that is happening in their body. And that is definitely going to be a topic that we'll be discussing in a future video, because there's a lot that can be said about that. But if you take that person who's having difficulty standing up out of a chair and can get a physical therapist in with them to help strengthen their legs, help strengthen their trunk, and work on that neural adaptive rehabilitation to help them improve their balance when doing things like that, you could likely prevent a fall. And for those types of patients, often they're over the age of 65. Well, number one risk of dying, this is not very said very much, but the number one risk of dying over the age of 65 is falling. It's not from some issue related to heart attack, strokes, not COVID, anything like that. It's falling. So you want to do everything you can to make sure that those particular types of patients are seen by a physical therapist and helped right where they are as soon as you can do so. To wait and think, oh, well, maybe the situation will pass, or oh, this will get better over time, is not the way to handle that. So in answer to the question of when is the time to seek physical therapy, when do you need physical therapy care, I emphasize early in the process. When it's first coming on, physical therapy can do quite a bit to try to help. Once you get down the road, let's say you've had a back that's been bothering you for several years now, well, you're so far down the road, that's likely leading to a back surgery. There have been plenty of patients where I've seen them and said, "Man, I would have loved to have seen you 5 years ago, when I could actually have done something to help to stabilize your core, stabilize that trunk, work on the strength of the abdominal and back musculature, work on the movement of those joints, so that you could build and avoid all of this pain and all of this surgery. But you can get where you're just too far down the line. So when is the time to seek physical therapy care? It is early in the condition. So that's I really, as I've said a couple times now, I can't emphasize that enough. As when you start recognizing that you are having pain and dysfunction with any type of movement, whether that be of a joint per se or of your body as a whole, your first thought needs to be, I need to go to a physical therapist. Your second thought needs to be, I need to get in front of a physical therapist soon, early. Do not wait. Okay? So I hope that brings a little recognition on the physical therapy field and when a physical therapist can be beneficial to you. Now, I will say, let me throw this also out there. Even if you haven't waited early, even if you haven't gotten into, or haven't waited early, even if you haven't gotten to in front of a physical therapist early, if you're still later on in the condition, there is still a lot we can do to help you. Okay, so it's not hopeless. It's never hopeless. There's always hope, and we can always help you to move better. Okay. And even after you have a surgery, surgeries are not the end of the world. It's after physical therapy or after, not physical therapy surgeries, after surgeries, you would have physical therapy for the vast majority of conditions, especially if there are any sort of orthopedic conditions, and we can likely help you then get back to where you were functionally even prior to having any of that pain and dysfunction, albeit with a new joint. So when I do mention that we do need to try to see you early to help with those conditions as soon as we can, I do mean that, and I do, that, as I say, that's really critical and important. However, it's not the end of the road if things were to progress, if it was to be a little bit later in time before we actually see you. We can still do something to help with you then. It just might be at a different level. It just might, like I say, be after a surgery, etc. So I hope that clarifies what I'm talking about, and I hope that helps you to recognize when you or a family member would benefit from seeing a doctor of physical therapy for yourselves to help with whatever issues you may be dealing with. So if this was beneficial to you, I ask that you subscribe to this channel, give a like to the video, and I look forward to seeing you for our next video, when we're going to be discussing how actually do you make an appointment to see a physical therapist. How does that go about? So I'll be detailing that a little bit more in our next video. All right, thanks a lot. Y'all have a good one.